It's my pleasure to have another webinar organized on the basis of the paper that joined GRAM. This is the GRAM, the new journal, open access of the International Society of Gynecological Endocrinology, which is added to the other journal that already we have since 35 years, Gynecological Endocrinology. This is one decision that we have taken, that from each issue, we present one or two authors and we organize a specific webinar on their paper. And today we had the pleasure to have with us Professor Alessandro Genazzani, which is also my brother. And Alessandro will present its expert opinion. You can see in the journal, the expert opinion was published in the third number of this year at page 146. This is the first page of the article, and it's an expert opinion on integrative treatment with inositols and lipoic acid for insulin resistance of polycystic ovary syndrome. Please, Alessandro, you have the microphone. You can go on, and then you can have your expert opinion. And after that, we will have a general discussion. You will see that we have a question and answer on your screen, and you can write your question. And I will introduce the question and Alessandro will make the answer at the end of the session. But please don't hesitate. When you have something, you write your question and then we will discuss at the end of his presentation. Alessandro, you have the mic.
Thank you very much, Andrea. Thank you to all the colleagues and friends that are right now online. So I have nothing to disclose. This is quite relevant to say, but the very starting point of this expert opinion, this is my opinion, if you want to see this story, is to understand a little bit more about PCOS. We have absolutely to be clear in this, that PCOS is not just an endocrine-based disease, but is something which is associated with this metabolism, which is quite clear since we have a high grade of these patients who are overweight or obese. They show the metabolic syndrome, hyperinsulinemia, the so-called insulin resistance, and most of these have also hepatic steatosis. Well, the real problem here is that in general, the disruption in PCOS patients is not really related to the endocrine disease, but in the interference that the metabolic impairment are able to induce on the reproductive ability, and how the metabolic disease is able also to impair most of the health issues in these patients. And the real thing is coming when these young ladies with, it's going on his own, is going on pregnancy, and these patients have a high grade risk of gestational diabetes, hypertension, and premature delivery, and greatly problems in the girls that are born from these young mothers who had PCOS. Well, the problem of hyperinsulinemia and insulin resistance is something which is built in our biology. Is something which is occurring during pubertal development, just to improve the development of our biology, of our body, of our organs, but it's also important during pregnancy, mainly during the third trimester, and this permits to have the growing of the fetus, and also during menopause, since during menopause the biology is with a less ability in finding food. You have still to remember that our biology hasn't changed so much from the Neanderthal period. So having insulin resistance, we can accumulate fat and have more, how to say, energy to survive to all the impairments of life. So what is real insulin resistance? Let's start to begin with the very basic of the story, just to understand how to face in an integrative ability this syndrome. Well, insulin resistance is the ability to maintain the perfect control of glycemia exactly producing higher amount of insulin, which is released in a higher amount than the expected. And you see here the graph, these patients are with hyperinsulinemia. So they maintain a normal level of glycemia over here. So they burn a lot of insulin. And the real important thing is to know that PCOS have at least in between 60 up to 75 of the patients with obesity, and at least 50–60% of them have insulin resistance. But we have always to remember that such insulin resistance might be present also in patients that have normal weight. Well, the story is coming from the fact that we have to keep inositol signaling under control. But what is inositol? Inositol is a normally occurring substance which is usually integrated in the control of the metabolism. But how is this metabolic story implicated in the good health of these women? Well, everything starts from the very beginning of life. And whatever are the impairments occurring during the pregnancy of the mother, or whatever is inducing the appearance of the UGR story or small for gestational age burn, might improve a disease which is related to the presence or the absence of the inositols inside the biology of each girl or each human being. Well, inositols are ubiquitarious substances that are able to transduce the signal of a lot of hormones, peptides hormones, inside the cells. And it has been demonstrated absolutely clearly that most of the cases of insulin resistance are related to an alteration of the insulin signal translation, which is related to an abnormal expression of a specific enzyme, which is called the epimerase, that modified some kind of inositols to other inositols. Inositols are a family of 9 isomers. The most important are myoinositol and dichiro. Myo is transduced from the form of myo to dichiro, and both of them are able to maintain the transduction of the signal for TSH, insulin, and FSH. And this is rather important since you know very well that FSH is the leader hormone just to maintain the ability to have the development of the follicles. So not only for the control of the metabolism, inositol are relevant, but also of FSH. Well, where are coming from the inositols? From food, absolutely, from beans and fruit, but also from our inner metabolic ability to produce inositols from glucose 6-phosphate. But the most important part of such production is related to the fact that we need an equilibrium between 2 isomers, myoinositol and dichiroinositol. Well, such kind of equilibrium is related to the fact that each of these 2 inositols are able to control specific ability inside the cells, inside the biology. So you see here, myoinositol is able to control glucose uptake and the control of the signal of hormones. The other one maintains the production of glycogen, which is the storage of glucose, and the production of androgen. So this is quite important inside the granulosa cells. Where are located inositols? In the inner part of the cell membrane, where they act, waiting for the hormone to link on the membrane. And then, as you can see here, they activate specific activity inside all tissues. With myo, you maintain the control and the transportation of glucose. With dichiro, the synthesis of glycogen. But inside the ovary, you have that myo is able to control FSH signaling, and dichiro is able to induce the control of the production of androgen. So this is rather important to control and to know, since inside the cell, myo is able to induce, after specific passages, the control of the GLUT4 vesicles expression and the movement of the vesicles on the membranes for the uptake of glucose. And on the other hand, the dichiro is produced in such way here to, how to say, amplify the signal of inositols and to induce not only the production from glucose, but mainly of the burning of the glucose using the beta oxidation. And how is relevant inositol? Inositol are irrelevant since they can be given as integration and they can, how to say, make more rich the biology of such kind of disposability of this compound just to improve the transmission of the signals. Well, when we started to use inositols at the very beginning, we were using just myo-inositol. And myo-inositol, you see here in 2008, was demonstrated by our group to reduce LH, to improve prolactin levels, but mainly to reduce insulin plasma level, not only here in obese patients, but mainly also to control glycemia and mainly reproductive ability. See here, LH is reduced, also in normal weight PCOS, reducing the amount of LH under the GnRH stimulation test. So this gives clear idea of the importance of the metabolic impact and the biological impact of the signal of inositols in these PCOS patients. But it's not rather important the ability of myo to induce the, how to say, maintaining of the signal of the stimulation inside the pituitary to produce LH or FSH, but it's important also in the ovary. You see here, this is a wonderful paper by the group of Artini in Pisa, where the ability of myo given before the induction of ovulation is to improve the amount of good cells, ovary cells, oocytes, and to have a higher amount of babies after having such integrative approach before the induction of the ovulation in polycystic ovaries. Well, the problem is also to understand why the balance between dikiro and myo is important. Well, these two substances, myo and dikiro, are produced in a specific rate. Higher rate, you have myo, lower rate, you have dikiro, thanks to an epimerase. Such epimerase is not working properly in all the people. It has been demonstrated, it's almost 10 years ago, that the amount of dikiro and myo in the urine is unbalanced. If you check these in patients with diabetes or PCOS, since an abnormal expression of the epimerase induces a reduced production of dikiro, and inside the urine, you have a rate myo to dikiro, which is incredibly higher in patients with diabetes. So when we started to use myo, we then thought that probably dikiro might be also relevant. And we tested these treating obese patients with PCOS, dividing the groups into groups, subgroups, those who had familiar diabetes and those who had no familiar diabetes. And so you see here that the patients with diabetes in the family have a higher response of insulin under the glucose load, but after giving dikiro in both groups, you see that the response after the treatment is almost the same. So the experience that we have here, and we published this some years ago, is that we probably are able to give again the right amount of dikiro and restore the exact ability of the system to reestablish a normal situation in impaired this metabolic situation in this patient. So the first thing that we have to say is that probably when we have a patient, the immediate ideal thing is to ask, there is anyone in your family with diabetes? Since the fact of having diabetes is probably something which is triggering an impairment in the ability of the biology to produce through the epimerase the right amount of dikiro. So the other story, just to better understand the things, is how then we have to think about lipoic acid. What is lipoic acid? Lipoic acid is a specific new item in the ability to control metabolism in PCOS patients. Well, lipoic acid is normally produced inside the mitochondrium, and is something which is working absolutely in an independent way from inositols. Is produced inside the mitochondrium through a lazy lipoic acid synthase. It stimulates the AKT, a specific protein inside the cytosol, and this amplifies the production of the GLUT4 vesicles to be expressed and move on the membrane of the cells just to have the upload of glucose. And such action is rather important since its ability to maintain the glucose uptake independently from the presence of a good amount of inositol. So it's a sort of an escape system. And look here, metformin has been demonstrated to amplify the action of lipoic acid on the MKPK just to improve the glucose uptake. So it's rather important also in the treatment in these patients to know where the lipoic acid is working. But the real new issue has been demonstrated in 2009 when it has been demonstrated that most of the patients who had diabetes, similarly to the diabetic rat model, have a reduction of the expression of the LASI enzyme, and so they have a reduction absolutely of the lipoic acid synthesis. And this is rather a serious problem since these impair the ability to have a second kind of control of glucose upload and of obviously insulin sensitivity. Well, we tested the ability of lipoic acid to maintain the control of the insulin sensitivity. And we treated patients who had diabetes in the family and patients with no diabetes in the family. Well, it's astonishing. This was the first paper to demonstrate that lipoic acid is no way improving reproduction, but it's always improving the ability of maintaining the insulin sensitivity in all patients, but greatly and in a higher grade in patients with diabetic relatives, but mainly controlling, and this is rather important, also the lipid profiles, controlling triglyceride and mainly reducing the transaminase. This is a rather important issue since most of the patients with PCOS, insulin resistance and obesity have higher level of transaminase and are at a higher risk of having obviously hepatic steatosis, liver steatosis. This is an important issue. So when we studied the response of the insulin in these patients with a glucose load, we found that patients with diabetic relatives have a completely different curve of insulin under the glucose load that was absolutely restored as normal in comparison to the other patients with no diabetes relatives, and has to be considered a sort of a restoration of the ability of the biology to control the release of insulin according to the control on the other side of the glucose in the blood. So this means that if we need inositols, we need also the presence of lipoic acid just to have a perfect equilibrium of the system. So just to go on in understanding better things, it's rather important, the evidence, the anamnestic evidence, if you have or not a familiar diabetes, we need to know that the epimerase expression is important, but we have also to remember that we have the chance to have a reduced expression of LASI, the enzyme that permits the synthesis of lipoic acid. And probably it's relevant to know that lipoic acid is as important as inositols, but lipoic acid is able to control mainly the metabolic system inside the cells. So probably we have now to consider that it might be good, a logic of the combination of inositols with the lipoic acid. And the problem is, what is the most important of the two? There is any logic to say one is better than the other? Well, I don't know if we have the right answer right now, but we have at least to understand what is relevant for the biology. Well, we made another interesting study where we treated a large group of patients with PCOS and obesity, a part of these with just Mio, 1 gram every day, a group with lipoic acid, 400 milligrams every day, or a combination of the two. And inside these groups, we have patients with diabetes or no diabetes in the family. And you see here that when administering just Mio, we have that only the patients with no diabetes in the family have the significant reduction of insulinemia under the glucose load. And when giving just in the other group, just lipoic acid, both groups with diabetes or no diabetes in the family have the improvement of these. So here we have the clear understanding that lipoic acid is a rather important issue that is able to keep the control of insulin sensitivity under control. And what's happening when we have the combination of the two? We have again the great reduction of both in patients with diabetes or with no diabetes in the family of insulinemia. So the combination of the two probably gives the better in equilibrium signal, having in mind that the presence of inositols is able to induce also other actions on the peripheral cells, such as the ovarian cells of the granulosa. And the other issue that we demonstrated was that in patients that had diabetes in the family, again, the combination of Mio plus lipoic acid is able to induce a greater reduction of insulinemia and of the OMA index. And this is rather important, since the other issue in these patients is not just the ability to have menstruation or just babies, but we need to have also good health. And good health is rather important. Such issue of the control of the metabolism and also of the aspect of ability to reproduce was given also with a combination of Dikiro plus lipoic acid. As you can see here, both groups of patients with diabetes in the family or no diabetes in the family were able to have the improvement of LH, androgens, and insulin, such as also the triglyceride profile, which is obviously an aspect mirroring the aspect of the glucose circulating in the blood. But you see that the patients that had a familiar diabetes, only these ones have the improvement of the profile for cholesterol, LDL, the transaminase, body mass index, and in both groups, OMA index. But the correction of the OMA index was greater in the patients with diabetes in the family. And what about the response? And this is rather interesting. You see here that when we check the ability as of the combination Dikiro plus lipoic acid to reduce the response in terms of amount of insulin released under the glucose load, you see that the combination Dikiro plus lipoic acid is able to give a greater reduction of insulinemia in the patients with diabetes in the family, also in terms of C-peptide. This is a rather important issue, since C-peptide represents the ability of the pancreas to respond to the glucose load. And such reduction gives us the clear idea that also pancreas is reducing the amount of insulin produced. In patients with no diabetic relatives, we have a slight significant reduction of insulinemia, but is not related to the ability of the pancreas to produce insulinemia. So this means that the improved sensitivity that we have in these patients is related mainly to the ability probably to degrade the molecules of insulin at the hepatic level, which is another issue that in the next future will be of great importance and for sure will be discussed. So what we have to say here, that the addiction to the points that we have told right up to now the use of the combinations of the inositols plus lipoic acid probably is really relevant, since we are able to modulate the presence of the glucose in the blood through the ability of Mio or Dikiro to give a higher upload inside the cell, and on the other side, through lipoic acid to maintain an escape system, just to give a greater grade of uptake of glucose. But the real control for reproduction is played by Mio and Dikiro, obviously. Well, the story here is to better understand also the relevance of lipoic acid. These are all new issues, things that the biological studies have clearly explored, but that up to now have not been introduced in the clinical practice as an understanding. Well, lipoic acid is a releaser of thiols group. And thiols group are relevant since are the one that maintain, how to say, the revitalization of glutathione as nitrose glutathione. And this is the most important, the most relevant antioxidant system that we have in our biology. And you know very well that PCOS patients have a high grade of hyperoxidation. And pro-inflammation in PCOS is something that maintains such kind of pro-inflammatory state. And whatever is able to reduce the nitrose glutathione production is impairing such passage of the GTP to the cyclic GMP, which is the one that controls the upload of calcium inside the cell. And this is an irrelevant issue that probably not all the gynecologists pay attention to, since the amount of calcium introduced inside the cell is the one that maintain or not maintain the contraction of the smooth cells in the vessels, and on the other side, with the same system, is maintaining a good or a not correct evolution and improvement of growth of the follicles inside the ovary. So we clearly have immediately kept the fact that with such thiols on one side through lipoic acid, and probably through the action on the metabolism through lipoic acid and inositols, we are able to maintain the development of the granulosa cells, the development of the oocytes and the quality of the follicle development, and in the same time to maintain and control probably also the control of the blood pressure, since we are able to act smooth cells of the arteries in our biology. So the presence of the use of inositols and the choice of the inositols in these patients with PCOS according to the presence or absence of diabetes, knowing that those who have diabetes might have also a reduced amount of lipoic acid, is relevant. And this is a trick that might help, obviously, patients that have inability to take and to use high dosages of metformin. And this is the final cartoon. We have to remember that PCOS is rather a very complicated disease. It's an integration not only of an endocrine disruption in terms of reproduction, but it's something which is involving with obesity, the probability to have dyslipidemia, to have an impairment of the glucose control on one side. But remember that these patients have been demonstrated to have a stress-induced hyperactivated adrenal function. And this is rather important since an increased adrenal function maintains the production of high level of androgens and exposes to a lot of these impairments, mainly metabolic syndrome, maintains the inflammation, oxidation, and precoagulant state, atherosclerosis, and the risk of cardiovascular disease. So when we treat and face integration in these patients, we give clearly a great hand, a great help in the maintaining and the control, obviously, of the good health in these patients. Thank you very much.
Thank you, Alessandro, for this beautiful presentation, which clearly indicate that we have that speaking of topics like polycystic ovary, but not only, we have to go more in deep. And what means to go more in deep? We have to be more aware how in humans, the general metabolism and also the general physiology of the various cell system is functioning. And you have demonstrated that inositols are one fundamental pillar who sustain the biology through their transformation to other molecules and for their fundamental role. But also, you have mentioned and you have included that alpha lipoic acid is also another substance which through a different way, originating from the mitochondria, a different way can activate the GLUT4 formation and the transportation of glucose inside. Then, in addition to what we know, also the basic functioning of inositol system and the basic function of alpha lipoic acid correlated function is fundamental for the metabolism control. And then now we have a series of questions. They are strongly rising. A first one from an anonymous is, you mentioned that you have to make an insulin, to evaluate the insulin resistance, you have to make an oral glucose tolerance test. The question is always necessary to have a 3-hour test?
No, we have a good experience in such evaluation of insulin resistance, also using just 2 samples, one time 0 before drinking the water with the glucose, and the second one after 90 minutes. The problem is very simple. Simple since if you have a, how to say, biology with an insulin resistance, your response with a high level of insulinemia occurs for sure within 60-90 minutes. So you do not need a complete curve of 3, in some places also 4 hours. This is important, this long test, when you have to evaluate in a more specific and sensitive way the amount of insulin and probably also of the C-peptide that the curve is releasing under the glucose load. So in a very simple way, I can tell you that a 0 and a 90 minutes later sample is good enough to have an idea.
Thank you. And then now I thank Christian Egarter is with us. And thank you very much, Christian, for your question. And the question is, since the ratio of mu-inositol and dihydroinositol varies considerably in different tissue, what justification do you have for a specific ratio with oral treatment? And then I would like to add, what are the doses of mu-inositol and dihydroinositol?
Well, the story of the ratio, mu to dihydro ratio, is something that has been, how to say, found and studied, just saying the amount of inositols going through the blood. But every one of us have his own, how to say, balance between these two. The problem is that the administration of the combination of mu and dihydro together needs to be a little bit, how to say, criticized. We have an issue. Inositols in general, the 9 isomers, so mu and dihydro belongs to the group of the 9 isomers, have the same structure of glucose. So every time that you have or you take mu and you have immediately after glucose, both glucose and mu compete to be absorbed in the intestine and to be used inside your biology through the same channels and receptors. So the first thing to know is that whenever you have the administration of one of the inositols, the best thing is to give just one of the two. Since whenever the mu and dihydro, if combined, reach the intestine where they are absorbed, they compete one with the other just to be, how to say, uploaded inside our biology. So probably the trick is to give just one of the two, just to avoid this competition. Otherwise, you have reduced amount of both inside. This might be, how to say, solved improving the doses, 2 grams, 4 grams of mu and 5 milligrams 500 milligrams of Dikiro. But the problem is that there is no standardization of the doses. The things that we have observed is that whenever you use inositols, probably it's better to choose what is the target on which you want to play your game. If you are trying to control this metabolic profile in these patients, probably if you know that the patients have diabetes in the family, the polymerase story and the reduced amount of LASI are the relevant issues. So Dikiro might be important, given alone, since the biology inside our body is able to produce amount of inositols, and we are able to absorb inositols also from the beans and fruits. But we are lacking Dikiro, since the polymerase in these patients is not working. So on the other side, if we want to test and check what is the problems in the patients with no familiar diabetes, probably just giving Mio plus lipoic acid is the best choice. Since if Mio is lacking, probably being that patients with a good epimerase activity is able to produce the right amount of Dikiro for each single tissue. So we are not really, how to say, pressing and urging a competition between Mio and Dikiro if administered together. So my idea is let's try to understand what kind of patients that we have. The story of diabetes or no diabetes, which has been observed and found almost by random chance, is a really relevant point, since we are really getting good results just understanding this clinical approach. And the fact that the lipoic acid is able to modulate just the metabolic aspect in PCOS is the key factor just to have a better control of the insulin sensitivity. And so the idea is use what inositol you might have as appropriate according to the patient. Mio plus lipoic acid, Dikiro plus lipoic acid. The combination of the two, there are a couple of good papers that have demonstrated that the use combined of Dikiro and Mio give the problem of the competition. So you need higher levels of both substances just to have a right upload inside the biology of both of two. So while having competition, just find the one that is really lacking and go for that.
And we have also a question from Darta Yakovishka. I thank her. She put a question related to the myoinositol resistant PCO. There are also myoinositol resistant PCO women. And what are your thoughts about the myoinositol plus lactoalbumin, alpha-lactalbumin treatment?
Well, these are all compounds, lactalbumin, that are able to improve the insulin sensitivity. So this is a perfect possibility just to improve the ability also of inositol. So you have a sort of amplification of the signal. The trick for the so-called myoinositol resistant is probably related to the fact that these are the patients who have a reduced epimerase activity. Because if you do not, how to say, epimerize Mio to Dikiro in the right amount, you are lacking most of the relevant aspect of Dikiro, which is the glycogen synthesis, so the accumulation of glycogen inside the cytosol. These create, taking away the glucose inside the cytosol, a gradient of concentration, which, how to say, make more easy for the glucose to pass the membrane of the cell and to be introduced inside the cytosol. So this might not be the solution, since after some time, you have saturated the glucose inside the cytosol, and whatever is the amount of Mio that you give, you do not have the adequate ability of Dikiro to induce the production of glycogen and also of the oxidation of glucose, who are the two relevant actions inside the cell to create the gradients, just to facilitate the upload of glucose from the extracellular spaces. So I think that the ability to check what is the patient that we have in front is the most important initial issue for the treatment.
And then Professor Shaikh Zinnat Nasreen from Bangladesh is asking, is there any interaction between metformin and the combination inositol plus lipoic acid?
Wonderful. This is a wonderful question. I have just shown in my short presentation a slide where we have that metformin and lipoic acid are working on the same protein, which is the AKT protein. Well, if you have lipoic acid administered together metformin, you amplify whatever are the signal and the good positive effects of the metformin treatment. And there are a couple of wonderful papers. One is from another Italian group from Siena, Professor De Leo, that have demonstrated that the use of metformin and lipoic acid also with myo-inositol permits to have in patients severely obese to reduce the amount of metformin from 3 grams every day to 1, having the same ability, perfect ability to control insulinemia and weight control, with absolutely the elimination of the side effects of the high dosages of metformin, which is one of the, how to say, most relevant negative aspects of the treatment of metformin. The higher is the dose, the higher is the rate of side effects.
Yes, thank you. And then this is an answer also for the Manju Navani question about the combined use of metformin and inositol. And then now another question. You mentioned that inositols, they have also are important also in the modulating the FSH receptor response. And then the question is, what is your experience administering inositol for a better ovarian cycle in normal women?
This is absolutely another important relevant issue since, well, the treatment for PCOS is absolutely necessary, but metformin and other treatments in PCOS have been overused and overestimated, and a lot of my colleagues have used also metformin and inositols in normal weight patients or with no PCOS. Well, metformin and inositols are not the same kind of treatment. Metformin is able to induce absolutely an improvement of the control of reproduction and metabolism, but mainly in patients who really have hyperinsulinemia. But for inositols, it's completely different, especially if these patients have no diabetes in the family. Inositols, especially myo, and a little bit of lipoic acid are absolutely useful since this amplifies in these patients the ability of having a good stimulation of FSH on granulosa cells. I have at least not yet finished. We have the study under preparation. We have a comparison of normal weight patients versus normal weight PCO patients. And we have demonstrated that the levels of progesterone in a normal controls treated with myo-inositol have a 22% improvement in comparison to PCOS, who have at least a 12% improvement. So this means that the good production of progesterone is related to good ovarian development and follicular recruitment. So this means that inositols are relevant also in absolutely normal, healthy women.
Thank you. And then another question. Is familial diabetes the unique advice to select the best inositol?
Well, at least right now, most of the data that our group have produced have been based on the aspect of diabetes. The other aspect is to check not really the presence of diabetes, but the anamnestic of the whole, how to say, of the whole life of the girl. I have mentioned in one slide the relevance of knowing if the girl, the young girl, had a UGR when she born or a small for gestational age. Such issues might be able to induce during infancy and also during adolescence. These are able to induce a predisposition to obesity, since, as Professor Bruni in Italy have clearly demonstrated, together with Ibanez in Spain, these are triggering a defensive insulin resistance with a defensive hyperinsulinemia in these young kids at the age of 4 or 3 years of age, up to the moment of the pubertal development. And this is a sort of biological response to protect that girl from being in a difficulty immediately after being born and during the first 2 years of development. So when the babies gain too much weight after they born, it's not so, how to say, good. And sometimes we have to keep this under control, since the higher is the grade of fat accumulated, the higher is the insulin response whenever they had food. So we have to keep the body weight control in our young daughters and young sons, since this might be the trigger also for hyperinsulinemia and PCOS with the pubertal development.
I thank you. It's an interesting question from Hikmat Nahum. Is inositol useful in recurrent miscarriage associated to the polycystic ovary?
Well, the group of Facchinetti here in Modena, Professor Facchinetti is my chief in our department, have recently published a paper in the American Journal of Obstetrics and Gynecology that the pre-treatment in the ladies with PCOS with inositols, or the treatment of the pregnant patients with history of PCOS, as soon as they know to have a baby and the pregnancy ongoing, reduced absolutely up to 50% the risk of spontaneous abortion and miscarriage. And this is a relevant, absolutely relevant clinical aspect that we need to know, since when the casuistic of this study was reanalyzed, the higher grade of improvement of the, how to say, evolution of the pregnancy was achieved in those patients that have familiar diabetes. So again, the story of diabetes is coming up, is a link, absolutely.
Yes, there is an interesting, an anonymous make a comment. Great talk. Thank you very much for Alessandro. Just a small question. Mitochondria play an important role via lipoic acid for ROS levels. Is the energy level and cyclic AMP level affected in any way?
Well, I do not have any data on this, but presumptively, this should be another important issue. Probably we really have the chance that the production of energy is impaired in these patients, and that the ability to work on the side of inositols and on the side of lipoic acid is able to restore somehow the ability to produce the right amount of energy. In regards to the story of the mitochondria, I want to stress the aspect that you know, Andrea, that inside the embryo, mitochondria are coming from the mother. And this means that the most relevant part when we are trying to understand who is diabetic in a family is the side of the mother. So if we really have diabetes, obesity, and other lipid profile impairment or whatever disease in the part of the mother of the young girl that we have with PCOS, this is the issue that we have to focus on. Since if we have an impairment of the mitochondria, they are coming from the mother. So it's relevant to know small, little, how to say, easy tricks, just to better understand how to face the diseases.
Thank you, thank you. Then another question. The anti-lipoic, alpha-lipoic acid and inositol or the inositol combination is the optimal. But what of the two have we to choose to get the best results in PCOS patient? This is a tricky question.
It's a really tricky question. Really tricky question. I can say that lipoic acid is for sure one of the issues on which we have to play our game. So PCOS patients need lipoic acid. You improve absolutely insulin sensitivity. On the other side, the presence of diabetes is the one that makes me choose more on the side of the chiro if I know that there is someone with diabetes in the family. But if you do not have anyone with diabetes, you might choose easily the use of Mio. The problem is that Mio, in the case that you do not have the presence of diabetes, is absolutely transformed in the chiro. So with just one Mio, you get both too. So you overcome also the problem of giving the combination Mio and the chiro, and you have the problem inside the intestine for the absorption of the competition of the two how we say, glucose-like molecules to be uploaded inside the biology. When you really have the presence of diabetes in these PCO patients, the probability with the chiro to improve, how to say, insulin sensitivity is higher. Since if you check in our paper, the one that have been published in Gram, one of the picture, you see that the fact that the chiro is able to improve the oxidative use of glucose to produce energy, and on the other side, to store glycogen, creates what I call the gradient of concentration, so that glucose is easily uploaded inside the cells through the Mio and lipoic acid activity. So this creates the chance to have the reduction at the good level of glycemia, and you improve also the insulin sensitivity in terms of the fact that you reduce the amount of glucose outside the cell, so there is no need of high level of insulin. So you somehow act on the system that maintains and controls the better glycemic profile. The other factor relevant is that when you give Mio, you really improve greatly the amount of Mio already present in the biology. And this might be good, optimal, at least for normal patients looking for pregnancy, since you improve and you play a game also on the granulosa cells. This is also occurring, obviously, in PCOS with no diabetes. But on the other side, patients who are obese and with diabetes in the family, they not only have probably a disease in terms of insulin sensitivity, but they have also a problem in the, how to say, ability to, how to say, control the reproduction through the impairment that this imbalance Mio to the chiro creates, since the insulin resistance is really high. And you know very well that the excess of insulin plays a negative action on the granulosa cells, inducing a higher production of androgens. And the higher androgens you have, the more the atresia inside the ovary is induced. So we need to control everything.
And also, I think it's important, right, that you mentioned also, in addition to the FSH, inositols are also important in TSH.
Yeah, absolutely.
And this is something also which have to be to consider. As you know, TSH a very important role, and thyroid function a very important role in reproductive function too.
Yes, this is thanks, Andrea. This is an important, very important observation. We know very well that whatever is the impairment of thyroid, well, we might have a greater chance of miscarriages. So the control of inositols indirectly on the thyroid function is also relevant. So the relevance for Mio to act on the, how to say, sensitivity to the TSH function on thyroid is another important aspect, especially in those patients that have subclinical hypothyroidism. So we have absolutely to keep this under control in elderly patients.
Yes, another interesting from an anonymous, I like to mention the role of exercise. Doing sport increases mitochondria and this activity, and is helpful to reduce weight, and therefore has a positive effect on insulin resistance and diabetes. What is your experience with sports and administering of inositol and or lipoic acid and or metformin?
Well, the relevance of physical activity is that induce a higher rate of consumption of glucose in the periphery. So this means that the amount of how do you say, glucose burn is improved absolutely. And this creates, for sure, a higher gradient of concentration and movement of glucose inside the cell, permitting a better chance to use it. On the other side, you know very well that the physical activity, improves in any way insulin sensitivity, since you have a higher expression of receptors, and on the other side, you have a higher, how to say, movement of energy. The fact that fat is released from the adipose tissues, mainly in the areas where you are applying energy and muscles movement. So this means in the femoralia area and in the gluteus, which are typical in these patients with obesity to have as constant with activity reduction of the weight, is one of the demonstrations. So the ability of myo-inositol is to act as a, how to say, inductor of better performance of the metabolic control. And on the other side, physical activity accelerate such efficiency.
Thank you, Alessandro. We are now approaching to the end, but still we have 250 participants. And I would like to put you, it's an anonymous, which mentioned something that I would like to make your observation too. He right. You mentioned the fetal programming. Is the root cause of polycystic ovary found during fetal programming?
Well, my idea, which is based on the many papers that have been done on animal models, have clearly demonstrated that during fetal life, you might have the preparation, or let's say the induction, to be predisposed to a PCOS. And such kind of such situation is, how do you say, more severe when the mother of that baby have PCOS, or maybe have any kind of diabetic predisposition in the family. So the experimental animals that have been exposed to excess of androgens have an abnormal sensibility to insulin. So these are just things that have been coming from experimental animals, but clearly induce the idea that if a mother has a PCOS, is obese, and have been suffering for hyperandrogenism, and is getting pregnant, creates how to say, an environmental situation that might predispose the fetus, especially if this is a baby girl, to have probably PCOS and insulin resistance as soon as this is born. So, well, you know, Andrea, what I think about the human life. We have been projected to be slim. So I have probably to lose more weight than the one that I really have lost up to now. But we are not able to protect our biology from the excess of food and from the excess of deposition of fat.
This is the reason why now we have a very huge amount of obese and overweight. Then the last question is that one. Can we give the inositols also to healthy women? There are side effects?
Absolutely. I can tell you that I have a daughter, 18 years old. She's doing a lot of sports. She eats pasta 2 times every week. She eats a lot of meat, but she's exercising a lot. She is physically perfect, let's say so no diseases, but she has 3 times every week a little bit amount of lipoic acid and myo-inositol. Since this creates perfect control inside the brain for serotonin, perfect control for the ovarian function, for the distribution of fat all over the biology of the body, and for the control of muscles. So no, at least no known side effects. Up to now, I have never read anything about that. And for sure, maintains perfection in the ability of the biology to work.
Thank you, then. Thank you very much, Alessandro, for this beautiful presentation. And I would like to invite all of you, if you have enjoyed, to follow us and to send your papers to GREM, Gynecological and Reproductive Endocrinology and Metabolism. You can submit your manuscript, you can read our article. You have to go on www.gremjournal.com, and you will have, this is another way to approach the International Society of Gynecological Endocrinology. And then now, waiting for the next issue of our journal, which will appear on December. In December, from the 2 to the 5th, we have also our 19th World Congress, who, for COVID reason, was completely transformed in a virtual Congress. It will be all online. It will be a fantastic event. We have nearly 800 presentations, a huge number of posters, oral presentation and poster will be freely available for everybody. But if you register, you can have a fantastic view of what are the latest evolution of gynecological endocrinology, going from basic science to the clinical application. You will enjoy. I hope that you will be all with us from the 2nd to the 5th of December in the magnificent scenario of the world. Because being a virtual Congress, with our spirit, we were expecting to be in Florence, but now we will be all around the world from the 2 to the 5th of December. And the Congress will remain online until the 15th of April. Then, thanks to all of you. Join GREM, participate, and join the ISGE Congress from the 2nd to the 5th of December. Alessandro, thank you very much.
Thank you to all. Thank you for being with us.